Good morning, everyone. Welcome. We'll begin in just a few seconds as we give everyone a chance to connect to their audio. All right. Good morning, everyone. Welcome to the San Francisco Interfaith Council weekly online briefing for faith leaders. Today's topic, the threat of COVID-19 variants and fighting the pandemic. This session is hosted by the San Francisco Interfaith Council and supported by the Joint Information Center of the San Francisco COVID Command Center. Some housekeeping for today. Audio, video, and chat will be monitored and recorded for record keeping, training, and quality assurance. By default, all participants will be muted and video turned off to minimize distraction. For chat, to submit a question or comment, select the chat button at the bottom of your screen and send a message to Q&A. They will be shared with the speakers and panelists after the meeting for response. Thank you. Get tested, San Francisco. You can save lives and stop the spread of COVID-19 by getting tested through your healthcare provider. If you don't have health insurance or can't get tested through your provider, visit sf.gov/gettestedsf or call 311 for information on getting tested at a city-run testing location. A safe and effective COVID-19 vaccine, coupled with continued preventative measures, are our best tools to end the COVID-19 pandemic and safely reopen San Francisco. Go to sf.gov/COVID vaccine for information on eligibility, vaccination sites, including locations, and links to book appointments if available. Now is the time to come together, San Francisco. We've been through so much in the last year. Together, we can stop Asian discrimination, bias, hate, and violence. The COVID-19 virus has no race or nationality. It is simply a disease. To report a hate crime, please contact the San Francisco Police Department at 415-553-1133. And now, at this time, I'd like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Lisa, thank you so much, and we extend our thanks to the amazing staff that you work with. This is our 46th program. We could not be doing it without this platform or without the leadership that you all offer. So God bless you and thank you. Good morning. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for faith leaders. In spite of the dramatic increase of those receiving COVID-19 vaccinations and the positive news trending in the media, a call to proceed with caution looms large in the greater struggle to fight the pandemic. One real threat to progress in fighting the pandemic is the emergence of variants, which increase the vulnerability of those yet to be vaccinated and could impact those fortunate to have received the requisite doses. This week's online briefing for faith leaders, hosted by the San Francisco Interfaith Council and supported by the Joint Information Center virtual outreach team, welcomes San Francisco Department of Public Health Deputy Director of Health, Dr. Naveena Bobba, who will shine a focus light on the real threats posed by the COVID-19 variants, the efficacy of the vaccines to fight them, and the need to continue to exercise all of the prescribed precautions. As we do each week, and without further ado, I'd like to welcome the chairman of the board of the San Francisco Interfaith Council, Kaushik Roy, to offer a welcome and to read the interfaith statement.
Thank you so much, Michael. Good morning, everyone. My name is Kaushik, and on behalf of the board of directors, I do want to extend a very warm welcome to all of you. Thank you for being with us this morning. I just realized a few moments ago, tomorrow night will officially mark 13 months from the time Mayor Breed's original shelter-in-place commenced, and we have come so far since then and are looking, for the first time, I think, really looking at a positive future ahead for us. But there are challenges, of course, and somehow Michael has always managed to have the most salient leaders from the city join us almost every week to discuss the most important issues. And this morning is certainly no different. So Dr. Bobba, I want to extend a special thank you to you and the leadership at the Public Health Department. You all have not received the credit you deserve, if I can say that, for where the city is at this moment. So thank you for everything you've been doing, but also for taking the time to join us this morning. I also want to always make sure to thank our amazing staff of two. Many people who might be involved with the council may not realize, because we do so much, that there are only two staff members that do it all. So Michael Pappas and Cynthia Zamboukas, please know not only the board, but the entire interfaith community of San Francisco is very grateful for your continued leadership and all you've been doing, especially during this pandemic. If you are joining us for the first time, a special welcome to you. I hope this will not be your last time, and I hope we will see you again. At the beginning of every interfaith event or meeting, there is an Interfaith Council statement we like to read. It's just a way to take a moment to remind ourselves why we're here all together. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer a prayer in this setting, it should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other that we might better understand the multiplicity of faith traditions in our city and in our world. Good morning, everyone.
Thank you, Kaushik. Thank you for your commitment to this program. As I mentioned, it's our 46th, and you've been with us for almost all of them. And thank you for your leadership as chairman of the board. When you have a small staff, to have a wonderful partner as the chair, and the leadership you've shown has been exemplary. And for that, we are incredibly grateful. God bless you. It is a great privilege to welcome, to ground us in a reflective moment, Swami Vedananda of the Vedanta Society of Northern California. I've known Swami for over a decade. He is a great friend, and he adds to the rich diversity of San Francisco's amazing interfaith community. Swami, would you lead us in prayer and meditation?
Thank you, Michael. And I would like to offer some very short prayers, which usually are spoken in the Sanskrit language, but I will simply give the English translation. Om, lead us from the unreal to the real. Lead us from darkness unto light. Lead us from death to immortality. Reach us through and through ourself, and evermore protect us from ignorance. May we hear with our ears what is auspicious. May we see with our eyes what is auspicious. May we enjoy with strong limbs and bodies the life allotted to us. Peace is in heaven. Peace is in the sky, on the earth, and in the waters. The herbs, the plants, and the trees are full of peace. Everything in the universe is pervaded by peace. May that infinite universal peace enter our soul and being. May everyone overcome all difficulties. May everyone perceive that which is good. May everyone obtain a peaceful mind. May all rejoice everywhere. May the Lord, the presiding deity of all sacred activities, be pleased. For the Lord being pleased, the whole universe is pleased. The Lord being satisfied, the whole universe is satisfied. Om Shanti Shanti Shanti. Peace, peace, peace be unto everyone.
Thank you, Swami. As I've mentioned in the past, you are the embodiment of peace, and your peace is contagious. God bless you. We are very blessed to have with us today the Deputy Director of Health for the San Francisco Department of Public Health, Dr. Naveena Bobba. I have to confess, lately, and I've been haunted by the immortal words of William Shakespeare in his famed play, The Tempest. He says, "What's past is prologue." Early on in the pandemic, I was looking for some guidance as to how the faith community responded in the 1918 Spanish flu. And there wasn't a whole lot that I could even find on Google. But what I did find was that at one point, there seemed to be this declaration that the flu was over. And church bells were ringing. And that was a sign that everybody could go back to what they thought was normal. And they did. And at that moment, when everybody started congregating, it set the stage for the worst relapse and the most deaths of the Spanish flu. I know that we have proceeded with caution, and I have to tell you, Dr. Bobba, that even though there wasn't a whole lot to be learned from the 1918 Spanish flu, this, as I mentioned, is our 46th program. We hope that these archives will be a posterity that others will benefit from should we have to go through something like this again. So your testimony today is very, very important. We welcome you. We welcome you to shine a focus light on the important issue of variants and the vaccine's efficacy against the variants, and and the importance of continuing to proceed with caution and to be faithful and respect the precautions that your department has given us. So without further ado, the floor is yours. We welcome you. You're with family today.
Thank you. Thank you all for those lovely words and the lovely introduction. And I do really appreciate the grounding in history and just on reflection, it has been such a monumental year with the pandemic. And I don't think anybody could have predicted a year ago where we would be today, including the vaccine. So it's my pleasure to give you an update on the variants. And to talk a little bit about, the future state. So if we can pull up my slides. Thank you. So as was stated, my name's Naveena Bobba. I'm the Deputy Director at the Department of Public Health. And I'm going to talk to you today about variants, what we know, what we don't know, and as well as the vaccines. So next slide, please. So just to start off with, I wanted to provide a definition of what a variant is. It's important to note that viruses constantly change, and they do this through mutating their genetic composition. So for coronaviruses, they are RNA viruses, and the genetic viruses, the genetic makeup of the coronavirus, it does go through mutations, just like human DNA goes through mutations. Sometimes these mutations create new strains. And so a variant is a version of the virus that possesses mutations that differ from its parent virus. Some of these mutations, they emerge and then they disappear and they don't have much of a consequence, but others actually persist. And one of the ways that we determine if there are variants circulating is that scientists actually actively sequence ongoing specimens that are being collected in the public, specifically positive specimens, to see if the parent virus is changing in any way and if those changes are making a difference, and require further study and precautions. As you can imagine, like I said, mutations do occur, and that's expected. So not all mutations are going to be concerning, and not all of them are going to rise to a level where we have to follow them. We worry in public health when a mutation differs from its parent strain in a way that either affects the ability for the virus to transmit. And I want to be mindful here that obviously we're more worried when transmission becomes worse, like it becomes easier to transmit the disease. But there are definitely, mutations that make it less transmissible, which is not as much of a concern from the public health perspective. We also worry about mutations that cause more severe disease, mutations that interfere with testing. Sometimes mutations can prevent our normal testing methods from detecting the virus, mutations that affect treatment or vaccine effectiveness. So those are all kind of the conditions where we start to monitor variants, if any of those things rise to a level, whether it's transmission, severity, testing, treatment, or vaccine. Next slide, please. So it's important to note that once we see a variant, that it needs to get classified, and there's 3 classification systems that the CDC has created around variants, the first is kind of what I would say the least worrisome. These are variants of interest, and they're used to describe newly emerging variants, which may have medical or public health importance, but we're just not sure yet. So those are things that kind of come up. And if you start seeing, this genetic sequence in multiple specimens, you think, maybe we need to start tracking this and see if there's actually a difference in this variant. And then the next level is variants of concern. And the variants of concern are variants that are thought to be more contagious or likely to cause greater illness, that there's actually evidence that they cause greater illness or severe disease, or they may impact treatment or vaccine response. So those are variants of concern. And then finally, the third type of variants is a variant of high consequence. And these are variants that have clear evidence that the measures that we have in place do not significantly reduce effectiveness. So this would mean, even the social distancing, the masking, the hand washing, the vaccine, the treatments, none of those really make a difference. Luckily, at this point in time throughout the world, there is not a variant of high consequence yet. So that's good news. We will go through the variants of interest and variants of concern in the next slides. Next slide, please. So I'll start with the variants of concern. There are, categorized into 4 different kind of tiers, the variants of concern. The first one I think that probably people have heard the most about is the B.1.1.7 variant, and that's the one that initially emerged in the UK. It was first identified in the US in 2020. So just to note, from the data from the UK and other parts of the world, the B.1.1.7 variant does appear to have higher transmissibility, as well as potentially higher mortality. One thing to note is all of this is, pretty recent emerging data. And there's a lot of data out there that also kind of contradicts this. So, you might have seen news reports this week that there was a Lancet study that showed that, in fact, even if there is higher transmissibility, it was calling into question the higher mortality. But the preponderance of evidence around B.1.1.7 is that it both causes higher transmissibility as well as higher mortality. Again, we'll have to continue to follow the literature as more and more cases worldwide are happening and in the US, and see if any of that changes. The vaccine appears to be effective against B.1.1.7. In fact, in the UK and Israel, where there's a lot of AstraZeneca, there's been a decline of case rates. And in other parts of the world, including the US, as Pfizer and Moderna and Johnson & Johnson have been rolled out, it does appear to be effective about B.1.1.7. So that's really good news. The next variant that I'll talk about is B.1.351. And this was initially detected in South Africa in December 2020, and it was first identified in the US at the end of January 2021. There is more of an increased transmissibility. It's unclear if there's an increased mortality, although there does seem to be literature supporting that. There is concern that B1351 the protections offered by vaccine might not be as full as the wild type. But I will note, both for Pfizer and Moderna, the trials for both of those started in the summer of 2020 when none of these variants were widely in circulation. So there are ongoing studies right now to see if these vaccines will be better or will continue to have protection against the variants, but we don't have all the data yet. We do know that there is some protection against the variants. Specifically, I want to call out Johnson & Johnson, because Johnson & Johnson actually, the way that they did their trials was a little bit different. They did them across the world, including in South Africa and Brazil and the US. And so they do have data that does show that the Johnson & Johnson vaccine does have some efficacy against some of these variants. But Pfizer and the Moderna vaccines, those trials are still being undergone, and also both of those vaccines are doing trials around booster shots as well in these variant settings. The next variant is variant P1. This was initially identified in travelers from Brazil. And actually, the travelers in Brazil were found in a routine screening at an airport in Japan in early January. And then it was first detected in the US in January of 2021. Again, this variant appears to have increased infection and transmissibility. The other thing to know about the Brazil variant is there is some concern that there's ability to have a reinfection. So even if you've had COVID once, potentially you could get reinfected with this variant. So that's something that is, again, the data is still being worked on. And then finally, the last two are the B1427 and the B1429, otherwise known as the California variants. And in fact, these two variants, I'm not even sure if we should call them variants, but they are variants that were discovered in California, and they have become the dominant strains in California. And they, both of these strains appear to have more transmissibility, from a 10 to 20% increased transmissibility. We do not have data, and it does not appear that there's an increased hospitalization or death rate, but again, that data is still being collected. This is likely, the B1427 and B1429 are likely what fueled a large part of the California's December surge. And so it has kind of made its way through the population. It does appear that vaccine is effective against these variants. Next slide, please. So the CDC has this map of the US that shows kind of where cases are in terms of variants. And you can see that variants are all over the US. And specifically in California, we've seen the B117 variant, we've seen the P1 variant, as well as the B1351 variant as well. But variants are throughout, occurring throughout the US. And I think most notably, some of the surges that are happening right now in the US, specifically Michigan, it is the B117 variant that is dominant there. So it is causing a spike in cases and hospitalizations. Just because you detect a variant in your proximity or within the state doesn't mean it's the dominant strain. And as I mentioned, in California, the dominant strains have been the California strains. There have been definitely, we've definitely found B117 in the Bay Area, but it is not the dominant strain. Whereas in some parts of the country, it has become the dominant strain. And this is just a good place to go. CDC has some great tools to just kind of keep an eye on where the variants are and where they're really circulating. and how much of an effect they have. I will note the way that the CDC does this is through case rates. So obviously California has a large population, so 750 variants found in California, or over 750 variants found in California, it's to be expected. But again, it's something that we're working across the state with our academic partners to ensure that that genomic surveillance continues and that we can really continue to monitor if there are emerging strains or new strains or variant strains that are starting to dominate. I will say one of the good things that's happening across California is case rates have they decreased pretty sharply and they've now plateaued. So we're not seeing increased cases. And that also speaks to, when thinking about variants and increased transmissibility or increased hospitalizations, we're not seeing our numbers moving in that direction, which is good. So next slide, please. So here, in terms of what's being tracked, as I said, there are 3 variants of interest being tracked in the US. I'm sorry, now we're going to move from variants of concern to variants of interest. And so there's 3 variants of interest being tracked in the US. And the first 2, B1526 and B1525, are the ones that were detected in New York in November and December of 2020. And it's not clear if these variants of interest actually have increased transmissibility or, are causing worse outcomes, or whether vaccines are impacted by them. So that's why they're labeled variants of interest. And then there's another variant called P2, which was detected in Brazil. And again, it's not clear whether this variant has, has any clinical impact or epidemiological impact. So all of these 3 are being monitored in the US as well, just to ensure that, we're keeping on top of it and seeing if in fact they do produce different outcomes. And then finally, you may have heard of a variant in the headlines called the double mutant. This particular variant is thought to have originated in India and makes up to 15 to 20% of cases in one region in India. We don't have a lot more information available to add on this. It was found in one of the labs in the Bay Area, but the consequence of this, whether it's even, the CDC hasn't labeled it yet a variant of interest or variant of concern. So that one is continuing to require more research and more public health understanding before it gets labeled. Next slide, please. So now that we talked about variants of concern and variants of interest, the question is, what can we do? And I still want to, what I want to reiterate here is the most effective way to reduce the emergence and spread of variants is to reduce transmission. The way that viruses live is that they're able to go from one host that is infected to another host that is not infected. And so the best way to reduce their ability to do that is to really cut that transmission off. So all the things that, San Franciscans have been doing so well over this last year, the distancing, the masking, all of, really adhering to the public health measures have helped really reduce that transmission. But additionally, one of the biggest tools that we have is vaccination. And, as I stated, vaccine does appear to be effective. Now, will it be the 90% effective as it was in the wild type strain? We'll have to see. But even if there's a reduction in efficacy, it can still protect you. So even a 70% efficacy will reduce the ability to transmit. And that is really important because, again, the way to really contain this pandemic and contain this virus is that if we can slow transmission enough such that the virus doesn't really have the ability to go from host to host and can't mutate, that will make a huge difference in where the pandemic heads. So vaccination is key, and the faster that we can get people vaccinated, the more protection we can provide the population and the less likely transmission can occur. But in addition, we will need to continue masking. I think there's been a lot of guidance around the type of mask to use and where the science and data have really converged around masking. But obviously the distance, the avoidance of large public gatherings and crowds will need to continue as we are getting the population vaccinated and understanding more about variants. Next slide, please. So I wanted to talk a little bit about the vaccine and vaccine efforts, because as I said, kind of one of our best tools around fighting variants and fighting the pandemic are the vaccination efforts. And I wanted to provide an update because, as you all know, the FDA and CDC recommended pausing using Johnson & Johnson on Tuesday out of an abundance of caution because there was a very rare type of blood clotting event that happened in 6 people that received the vaccine out of almost 7 million doses. And this this is exactly how the system is supposed to work. If there's a signal that there might be a concern with the vaccine, the CDC, the FDA, and all the scientific community moves quickly to ensure that the safety is still there. And what happened yesterday is the immunization practices, the advisory committee on immunization practices convened to discuss Johnson & Johnson. And what they decided is, because this is so rare, they still need a little bit more collection of data. So they have said, they want to continue this pause for, about another week while more data comes in, and then reassess to see what the real risk is, and then to make a recommendation. So Johnson & Johnson will, we will continue to pause that while we wait for kind of the national and federal guidelines and decision-making to occur. But the most important thing to know is that if you are more than 3 weeks out after getting Johnson & Johnson, there is less of a concern. In fact, there is pretty much no concern because almost all of these impacts occurred within the first 8 to 13 days after getting the vaccine. But if you are within that 3-week time frame, and if you have severe leg pain, abdominal pain, or headaches, which can be a sign of a clot, the recommendation is to talk to your doctor about that. But again, this is very rare. It was mainly out of the 6 cases, 5 of them were in females. And this seems to be something very similar to the adenoviral vector viruses that we were seeing in the AstraZeneca issues that were occurring in the EU. So we'll wait to hear more, but just want to give that update. Right now, the county and the rest of the healthcare systems are vaccinating with Pfizer and Moderna. And I guess one of the silver linings here is that we got very limited Johnson & Johnson at the county just because of production issues. And so it wasn't in wide circulation, and we were able to remove all of or the few doses that we got and replace them with Pfizer and Moderna. So we do not anticipate major disruptions in our vaccination efforts. Next slide, please. And I just wanted to briefly highlight what our vaccine strategy is. We have a 3-pronged strategy of, wanting people to go to high volume vaccination sites that can do a number of people in a day. That's our Moscone site, City College, and the Produce Market in Bayview Hunters Point are our 3 high volume vaccine sites and have done lots of vaccines up to date. But we know not everybody can go to the high volume vaccine sites. And so we also have community vaccine access sites. And these include our neighborhood community clinics. We also have neighborhood sites that are done in partnership with our community-based partners. And we have, our mobile units. And the mobile units are deployed in different ways. They may go do an event in an area that has been determined to need vaccine and then come back, 3 to 4 weeks later to give the second doses. But they are also going to homebound individuals and providing vaccination to those that cannot get to a vaccine site. And then finally, our pharmacies, including CVS, Safeway, and Walgreens also have vaccine. And specifically, CVS and Walgreens are getting vaccine directly from the federal government and are getting allocations directly. Next slide, please. So the good news is everybody in California age 16 and above is currently eligible for vaccine. I do want to say that there is only one vaccine that is approved for those that are age 16 and 17, and that is Pfizer. So if you are booking for, your own child or a guardian, if you're a guardian of a 16 or 17-year-old, you really do need to make sure that it is Pfizer that person will be getting. But 18 and above, Pfizer and Moderna are approved. We have different ways that you can access vaccine through the county system. If you go to sf.gov, get vaccinated, it provides all of the different resources within San Francisco to get vaccinated. You can also use the state system, which is My Turn. And My Turn will allow you not only to get appointments within our county, but also within a 50-mile radius if there are open appointments. And then we do have a call center specifically for those who might not have digital access, or for, if somebody is homebound, they can call 628-652-2700 to inquire about vaccine, and if appropriate, can get connected directly to a vaccine appointment. And it is also, I just want to note, supplies are still limited. So even before Johnson & Johnson was taken offline, we were told that the amount of vaccine that we would be getting this week and throughout actually the month of April would be lower than what we've received previously. So as we are opening up, unfortunately, our vaccine allocations are on the slimmer side. So one of the things we have asked is for patients, we will get to everyone and everyone will get vaccinated. It just might take a little bit longer than we were anticipating. And we are really working on advocating that San Francisco get more vaccine. Next slide, please. And finally, in no small part to all of our partners, including the interfaith community, we have made great progress on vaccinating San Francisco. And I'm really proud to say that almost 60% of our 16 and older have at least gotten one dose of vaccine, and 36% have gotten the 2 doses. So we're well on our way to vaccinating a large part of the population. And then specifically the 65 or older, which the reason I'm calling out 65 and older is that is where we were seeing most of our hospitalizations and deaths occurring. A whopping 84% have at least gotten 1 dose, and 68% have been fully vaccinated. So really, we've done a lot of work as a whole community and as a whole city to get this prioritized group vaccinated in a fast manner. So that's wonderful news. And then finally, the last slide, I do want to point out for variants. One more slide. So yeah, thank you. For variants, the CDC has really great information and it updates it on a regular basis. You can also see where the variants are occurring in the US, like I said, whether it's the B117, B1351, or the P2 variant. Those are all done on a map, but they also have the global map of where these variants are occurring throughout the world. So, and they have really good definitions and explanations of where we are in terms of what the variants are causing, if they're causing transmission issues, if they're causing mortality issues, if they're causing issues with treatment or vaccine. There's a lot of information on the CDC website. And then if you want more information about vaccines, please visit sf.gov, get vaccinated, or as I said, you can go to My Turn or call the call center. And with that, I will stop here and I'm happy to answer any questions.
Dr. Bobba, thank you very, very much. I did want to reassure you that by day's end today, this recording link, along with all of the resources that you have shared, will be sent to our 5,000 e-subscribers. And so you know the role that the Interfaith Council has been playing is, in addition to these briefings, we've been disseminating all of the really key releases coming from the Department of Public Health and the Mayor's office, as well as how to get vaccinated and other resources from the state. So we're doing our part. We're helping to get clarification when there's confusion, and that's the role that we are playing with this program. one of the takeaways that I got from your presentation was not just that we should get vaccinated, but the globe should get vaccinated, because we are no longer folks who just stay where we are, but because we travel, that these variants can come to us and we can take them to other people too. So the importance of equity as well as global vaccination should be a priority. You asked for questions, and we're going to give you questions. I'd like to, at this point, introduce someone who's played a real pivotal role, not only with our council, because he also serves as the treasurer of the council, but with the city at large, and that is the Community Partners Group Coordinator of the COVID Command Center's Joint Information Center from the Department of Emergency Management, John McKnight. Another role John has been playing is within his role in the Department of Emergency Management. He's been convening on a weekly basis a group of faith leaders to answer their questions and give them up-to-date information as well. John has amassed a few questions that I think are pretty significant. And so at this point, I'd like to invite John to the floor, and he'll pose the questions, and we look forward to your responses, Dr. Bobba.
Thank you, Michael, and greetings, Dr. Bobba. Thank you again for being here today. A lot to chew on from everything you put out there. My first question has to do with variants, how they're affecting our vaccinated and our unvaccinated population. Are we going to see a fourth surge?
Yeah, I mean, it's a great question. I think, and I can't predict completely. One of the things to note is that the data on how variants and vaccine interact are still emerging. As I mentioned, Johnson & Johnson was one of the few vaccines that actually did trials when these variants were circulating across the globe, and does have some efficacy data on that. Moderna and Pfizer are doing those trials now, as well as doing trials around booster shots. But it does appear, specifically in the UK and Israel data that we've gotten, that the vaccines are effective, at least against the B117. There's less data around the B1351 and the P1, and so we'll have to see what that data shows. But even if there is a reduced efficacy rate, there is some efficacy. And so that will reduce transmission. So I think one of the big messages here is, if you've gotten vaccinated, that is one of the best protections that you can provide you and your family in terms of preventing disease.
Thank you. You touched on my next question a little bit, and that is, what do our lives look like after this? But I want to take this in a particular direction. Yeah, I'm about to have dinner with some friends. The first time my wife's going to get out in about a year. She's looking forward to joining a family. Everyone's vaccinated except this 15-year-old boy. He's not going to be vaccinated for a while. And I have to think that very soon we're going to get to this point where we realize that all of our youth remain unvaccinated while the adults are. So what's life going to look like going forward? And I want to think about this from a moral perspective, as we need to take care of youth that are unvaccinated. And what is the timeline for them to receive vaccinations?
Yeah, it's a great question. And it's something that we definitely, recognize that there's going to be a segment of the population that is, getting vaccinated, and there's a whole segment that's not. But I think the really good news here is that Pfizer has actually applied for FDA approval for their vaccine for 12 to 15. So we'll have to see when the FDA schedules that. But that was a lot sooner than we were anticipating. And so, given that they've applied for that, I have a lot of hope that we will get an answer for 12 to 15-year-olds relatively soon. And then that way we can also, roll out Pfizer in that group. And then their trials have already launched for 6 months to 12-year-olds. And given, that Pfizer was able to get the 12 to 15-year-olds and saw a really good efficacy fairly quickly, we're hoping the same thing will happen for 6 months to 12-year-olds. And, I don't want to be quoted on timelines here, but I've heard, summer, fall timelines for starting to vaccinate that group as well. So, if the data continues to look as good as it did for 12 to 15-year-olds, there is a lot of positivity in that these vaccines will be available for most of the population come fall.
Thank you. Thank you. Do you, as our deputy health officer, recommend the city remain masked while our population of children remain unvaccinated?
Yeah, it's a great question. And I think the masking issue is complicated. right now, actually, the CDC is allowing for vaccinated individuals to come together without masks. And then there is some leeway that if you can have some unvaccinated people in there, but they have to be within the same household. So I think this is going to be an ongoing discussion and a debate, especially again, given the timeline of when vaccine will roll out for those over from 12 to 15 and then those under 12. We are going with masks for right now, but I think as the science and the data emerges around this, the other thing to note is that when we've looked at the virus and how it transmits, it does appear that in those, especially children less than 12, the disease is much more mild, right? And so we have to take that into account that, balancing the need for socialization and wanting kids to have, things that have not been accessible to them for the last year, including our schools, balancing that with the disease. So I think there will be a lot of discussion, but I think all of it is moving in the positive direction. And I think that we will continue to at least have masking in that age group until we do have vaccine available.
Thank you. Thank you for your comments on that. There was some comments you made earlier about the manners by which the scientific community is monitoring for these variants. I had a virology professor at Berkeley, and he spent his weekends in Bakersfield dissecting mosquitoes, looking for, and that still makes my mind spin to think of what it must take to do that. But that's how I realized he was making sure that viruses are not being spread by the mosquito population. What an amazing work. What is the take for us to monitor for variant uprising in the state? What does that actually look like?
Yeah, I mean, and I think this is where we can, really look towards our global partners that have some of these surveillance systems in place. In general, in the UK, I think they're doing about 5%. They're taking 5% of their positive specimens and looking for variants. So they have a very robust way of looking for variants. And the US is trying to get there. I think this is a major difference is that our specimens are not centralized like in the UK, right? Where it all goes to one national health system and you can easily kind of figure out how to get it genomically sequenced. Given that there's so many different players in the US in terms of testing and, resources and labs, private and public, that it's a little bit more having to get everybody in the same room to really develop that system. I will say, California is definitely trying to do that with its academic partners, with its large healthcare systems like Kaiser, and with its public health departments. And we're getting there. It's just been a little bit of a slower process than maybe a centralized system would. But that's how these variants get determined, specifically the California variant, right? It was found in California by our researchers and by our academic partners. And so the system is working. It just needs to have that infrastructure to be really, to have ongoing robustness.
Yeah, I recognize that the samples are being taken from people that show a positive COVID test. Does that mean testing still needs to be active in our communities?
Yes, absolutely. And there's a lot of reasons why testing still needs to be active. I mean, as you said, there's going to be a proportion of the population that is still not vaccinated. So we need to ensure that they are not getting the disease. So testing still needs to be part of everyone's thought process if you develop symptoms. The other thing to remember is that these vaccines are very effective in real world efficacy. For Pfizer, it's about 90%. But that does mean, 10% of people will still break through. And so if a vaccinated person starts to have symptoms, they shouldn't, completely dismiss it and say, oh, this can't be COVID, I was vaccinated. It's still really, or if they've been exposed and are worried about that exposure, this is something definitely to talk to their provider about, or to the health, their trusted health partner about, to ensure that they are, protecting themselves and their family, and if needed, they should get a test. So our testing program continues to occur and continues to be something that we really recommend people do if they have concerns. And specifically, like I said, the people who have not been vaccinated, that they should get tested.
Thank you. Thank you. As we look at the variants, I was struck, you said over 750 variants in California. What a profound number.
Oh, I'm sorry. No, cases, not variants.
Cases. Oh, okay. I was like,
No,
wow,
over
I could
70
imagine that. All right, then I got that wrong. Thank you.
Yeah.
All the same, we do see a list of variants that are popping up. We know this is just the natural development of the virus. And of course, as you pointed out, a virus can't mutate if it's not replicating, and it can't replicate without a host. This is why our vaccines are essential. Though we do know that some of these variants may eventually break out and make themselves less affected by the vaccines. What does this mean for the future of vaccines? Are we developing boosters? You mentioned something about this a moment ago. Do you imagine us being a world that receives boosters with some periodicity going forward? What does the future look like?
Yeah, I mean, this is definitely something I think that everybody's, watching and looking at. And actually, I know Moderna and Pfizer, and actually Johnson and Johnson, I'm sure AstraZeneca too. They are looking at efficacy of booster shots, specifically booster shots, not just for the wild type variant, but also for all of these other variants that are occurring. So those trials are underway. I think one of the things is because these trials just started last summer, we have to see what the duration of efficacy is. And the duration of efficacy, when we had the wild type virus versus now with these variants circulating. So I think the data is still being collected around that, but definitely all of the science is moving towards having, boosters available if needed. And I do believe that Moderna is actually looking to have these trials ready so that, if there is a booster shot needed in 2022, that would be available to the public.
Thank you. The current state of this disease in our population shows that it's still spreading, but fortunately, as I even see the replicative number of 1, fortunately, we're not seeing a huge spike. It makes me think the vaccine's working. It's dampening the spread throughout the community. But there are communities we're still struggling to reach. There are people that have trust issues. What would you say to somebody, I understand there's a number of ranges of trust. What would you say to somebody who's on the fence right now about the vaccine to help them move in a direction that, I think would potentially saves their lives? What's your advice to people who are speaking to their congregations? We have people who are on the fence about the vaccine.
Yeah, I mean, I think, some people are kind of wanting to wait and see. And I understand that. I will say, as of now, Pfizer and Moderna, there have been over 100 million doses given, right? So it's probably the most vaccine that has been given in any significant period of time. And if there were issues with that vaccine, we would have seen it by now. So I think people can really rest assured of how many people have gotten this vaccine. It is not, in any way kind of a trial or a test run or even, under a study design, right? A vast majority of way more than any study could ever do have gotten this vaccine and have done very well with it. So I think that reassurance to say, we're way beyond, waiting for, if a certain number of people get it, will there be problems? We've tested that out and have come back pretty good with that information. I think the other concerns about, what about, Johnson & Johnson? And it's exactly what happened is exactly what is meant to happen. So, as Johnson & Johnson, which just started to roll out, a very rare event was picked up. And so if people have concerns like, oh, I might, have a bad event happen to me, there are mechanisms in place to ensure that gets picked up very quickly, and that, all the public health measures are put in place to ensure that we're protecting our population.
Thank you. Michael, I think I've still got time for at least one more.
Absolutely.
Good. Let's go back to Johnson & Johnson efficacy. There are a lot of medications taken by people in this country, and I want to be respectful of people who have specific medical needs. I think of this, we have a pandemic, everybody is suddenly in the same boat. Many drugs, many medication, many treatment have significant or noticeable side effects. They have risks. I think we're looking at Johnson & Johnson, which could be a lifesaver for many people, is we're looking at 6 cases per 1 million. I'm trying to compare that number against some of the risks we take with other medical actions. Can you elaborate on this a little bit?
Yeah, it's a great question. I mean, some of it is, and I don't have the numbers ahead of me, but like when you get in a car, your risk of getting in an accident is probably much higher, and a fatal accident is much higher, right? We take these risks for granted, and then when things get spotlighted, there's a lot of concern. And that's not to downplay the fact that there is something here potentially with Johnson and Johnson, but like you said, there's this risk benefit, right? And the risk of getting COVID and having severe disease and having disability from it is much higher than the risk of suffering a really rare event. And right now, Johnson & Johnson isn't available right now, so people can utilize the Pfizer and Moderna. But I just want to remind people, when Pfizer and Moderna came out at the very, very, very beginning, if people remember, there was this worry about anaphylaxis. And I remember getting a lot of questions about that. Am I going to have this terrible allergic reaction where I'm going to die? And that has not, yes, in rare places, people do get anaphylaxis, but the vast majority of the population has not, and it has done very well with that vaccine. So I do think we're going to have to wait to see what the FDA decides around Johnson & Johnson. But I think it's great to put it in that context around the risk benefit of any one intervention.
Great. My last question to you, this is looking to our future. Rotary International spends tremendous resources to eradicate polio worldwide. This was a disease that I think a lot of people are beginning to forget what it used to look like to have young children on iron lungs. And we have nearly eradicated this from the planet. Do we have a chance of eradicating COVID-19 from the population? Is there a future in our sight where COVID is a memory and no longer something we have to live with?
I mean, it's a great question. And I don't, COVID has thrown all of us for so many loops. I hate to try to predict what the future is, but most of our, preeminent epidemiologists, virologists really feel if vaccines are effective in the next few years, that like much of the coronaviruses, this will end up being very similar to like a cold. Just a viral illness that people have that if a certain percent get, but doesn't have the impact of a global pandemic to it. Will it completely eradicate that? I don't know. And I haven't seen any discussion around that, but I have seen the idea that it might end up to just be, your normal benign upper respiratory tract infection or cold.
Thank you, Dr. Bobba, Bobba, and I appreciate your time today. Michael, I hand the microphone back to you.
Thank you, John, for those very insightful questions and important questions. And I know we've been talking about looking into the future. I have to tell you, popping up on my phone today was a post I made a year ago. And it noted that Harvard researchers were predicting that we would be social distancing through 2022. And so I just, in the end, Dr. Bobba, would you just address the need, once again, getting the last word, for following the precautions?
Absolutely. I mean, I think, again, I know this pandemic has felt long, but I really want to applaud those in San Francisco and the Bay Area and their ability to really follow these directions. I do think that's one of the reasons that we have been able to see lower case rates and mortality rates compared to the rest of the country, is really the social distancing, the masking, the avoidance of crowds, really wanting to protect ourselves, our loved ones, our community. And so that's a very important message. We have not gotten people fully vaccinated. We do not know where the variants will go. And it would really be, it would be a waste of a year if we went back to our normal state and allowed coronavirus to kind of run its course through the population again. So, we're almost there, we're getting there. And I think, again, the science is evolving every day and we're getting more definitive answers. So just really would urge people to continue with this path to ensure that, we can get through the pandemic and end it together with our loved ones, with our family, and with our community.
Thank you. I want to thank you not only for the time you've given us today, it's been truly a gift, but on behalf of the faith leaders of our 800 communities of faith and religious organizations, we have been putting out in real time the credible material you've been sending us. And I know that that has been critical in helping our faith leaders to make informed decisions on behalf of those who are under their care. And so for that, please extend that to Dr. Phillip, to Dr. Colfax, and to all our friends at the Department of Public Health. God bless you. We pray for you. You are like the hands of God at work.
Thank you. I appreciate that.
As we're saying thank you, I also want to extend a heartfelt thanks to my partner in interfaith work, Cynthia Zambucas, who is my right and my left hand, as well as to our amazing team at the COVID Command Center, Joint Information Center Virtual Outreach Team, in particular, Alyssa Karawala and Sharon Walton. I know that we have Nick Marino and Hafisa Salabai with us as well today. You all are amazing partners in our work. We would invite everybody to join us next week at the same time, where we're going to celebrate Earth Day with the Director of the Department of Public Health, Debbie Raphael, and we'll look at the COVID's impact on the environment, challenges we faced, opportunities that have presented themselves. So please join us then. This brings to a close today's program. Again, Kaushik and Swami Vedananda, thank you for your participation, and John McKnight as well. Bless you. God bless you.